Hello everyone, welcome back to Community Medicine Insight. In today's video, we will discuss National Deworming Day, why it was launched, what are the various common soil transmitted helminths and how they affect children, objectives and implementation strategy of National Deworming Day, the dosing schedule, important precautions and the possible side effects, and in the end we will see how to prevent reinfection. So by the end of this video, you will have a clear understanding of the National Deworming Program and its public health importance. Soil transmitted helminths are intestinal parasitic worms which are transmitted through soil contaminated with human feces. These infections are an important public health concern, particularly in the areas where sanitation, safe water and hygienic practices are inadequate. In India, approximately 22 crore children between 1 to 14 years of age are estimated to be in risk of worm infestation. To address this problem, Government of India launched National Deworming Days in the year 2015. This program follows a fixed day approach and is conducted across all the states and union territories in 2 rounds every year. So, first round is conducted on 10th of February, followed by second round on 10th of August. The main objective of National Deworming Day is to deworm children and adolescents between 1 to 19 years of age, including both enrolled and non-enrolled children. This program aims to reduce the burden of intestinal worms and prevent worm-related health problems. By reducing the worm infection, the program also aims to improve the overall health and nutrition status of children. Promote better access to education, as deworming helps to reduce the adverse effect of worm infections on growth, physical well-being and school participation, and also enhances the quality of life of children and adolescents. The 3 major soil transmitted helminths are roundworm, hookworm and whipworm. Heavy infection may cause malnutrition, abdominal symptoms, and in severe infection it can also cause intestinal obstruction. Hookworm infection occurs when the infective larvae present in the contaminated soil penetrates the skin, and it usually occurs when a person walks barefoot. Because of the chronic blood loss, it leads to iron deficiency anemia. Whipworm infection also occurs through ingestion of infected eggs, and heavy infection may cause chronic diarrhea, dysentery, and in severe cases, rectal prolapse. Soil transmitted helminths can be transmitted by following modes. It can be transmitted by eating food which is contaminated with soil containing worms' eggs, or by drinking contaminated water, or if the person is walking barefoot on contaminated soil. Open defecation leading to soil contamination also helps in the transmission. Poor hand hygiene also contributes to transmission of these helminths. In this slide, we can see the clinical impact of worm infestation. Thus, deworming is very important in children. It can lead to various nutritional problems like iron deficiency anemia, malnutrition leading to poor appetite, poor physical growth leading to stunting. Child is always fatigued and complains of weakness. This also leads to abdominal pain, diarrhea, and in severe infestation, it can lead to intestinal obstruction. Apart from these symptoms, it also leads to reduced cognitive development, poor school attendance, reduced academic performance. Therefore, deworming is important even if the child is not showing any sign and symptom. Coming to the implementation of this National Deworming Day, what is the meaning of fixed day approach? Fixed day approach means that deworming medicine is given to all the eligible children and adolescents on pre-decided common date, rather than waiting for each child to visit a health facility individually. National Deworming Day uses existing schools and Anganwadi centers as a platform to reach the large number of children. Children between 1 to 5 years of age are covered through Anganwadi centers under the Ministry of Women and Child Development, While children and adolescents between 6 to 19 years of age, which are covered through government and government aided private schools under the education system. A mop-up day is also organized after the fixed day to provide the medicine to children who were absent or missed on the main day. Fixed day approach help us to reach large number of children in short period. This improves compliance and coverage as these dosage are supervised. It also ensures uniform implementation across an area and thus makes the supervision, monitoring and reporting easier. Drug of choice under the National Deworming Day program is Albendazole. And how does it work? It is a broad spectrum anti-helminthic medicine. What is the mechanism of action? It acts by interfering with the worm's ability to take up and utilize glucose, and as a result the worm's energy stores become depleted, leading to immobilization and death. And the dead worms are subsequently expelled naturally from the body. Children aged 12 to 23 months, the recommended dose is 200 mg, which is half tablet. The tablet should be crushed carefully between the two clean spoons, and a small amount of clean water may be added to help the child swallow the medicine. Children and adolescents aged 2 to 19 years, the recommended dose is 400 mg, which is a one full tablet. The tablet should be chewed thoroughly before swallowing. The medicine should be administered under the supervision of designated teacher, Anganwadi worker or trained health personnel. Children should not receive the medicine on the day of deworming. These include children below the age of 1 year, children who are seriously ill on the day of deworming, or individual with a known allergy to albendazole. Below the age of 1 year are usually not given albendazole during routine deworming because the safety evidence of preventive use in this age group is limited. The risk of soil transmitted worm infection is generally lower. Therefore, routine deworming begins after the completion of 1 year of age using an age appropriate dose. So, if any infant is either suspected or is having confirmed infection of these helminths, then they will be assessed individually by the pediatrician and they will be given treatment. Albendazole is generally a safe medicine and most children do not develop serious side effects. Occasionally, children with heavy worm infestation, they may develop mild abdominal pain, nausea, vomiting, headache or dizziness. These symptoms are usually mild and self-limiting, so it is important to inform teachers and caregivers. Unnecessary fear or concern can be avoided. However, if these symptoms are severe or persistent or the child is worsening, child should be taken to the nearest health facility for appropriate management. Coming to the prevention of reinfection. Deworming alone is not sufficient to stop the transmission of soil transmitted helminth. So, deworming should be combined with proper hygiene and sanitation practices. Therefore, children should use toilets and avoid open defecation. Hands should be washed with soap before eating and after using the toilet. Children should wear footwear while walking outdoors because hookworm larvae can penetrate the skin. Fruits and vegetables should be washed properly. Safe drinking water should be used and fingernails should be kept short and clean.